Dr. Johnson, why are Black women dying at just higher rates in general?
It's harsh and people don't like to hear it, but just as Dr. Ruffin said, it's institutional economic racism. What we picture when we talk about Black maternal health and mortality is they're more obese, they have hypertension, they are older, they have more children, and that they came into pregnancy sicker. What that is what we call shame blame, in that it's her fault that she is not able to have the same outcomes.
When we think of this experience of this person coming through and interacting with a day-to-day life of all of this stressor, so it's this chronic stressors, this racial stress, as it's been called as well, and then they show up to their appointment. Well, understandably, they might have some anxiety. There might be some things that they're expecting also at that visit based on their past experiences in the healthcare system. And so now they're showing up with this elevated heart rate, right?
Yeah.
Blood pressure's a little high. And so they're feeling anxious, and then they're not able to communicate in the way they would like because they're anxious, and maybe because of the responses that they're getting. So they're not sharing their concerns, or their concerns aren't being heard, even if they are shared, because maybe someone's already expecting this to be related to other things. So we're missing something.
Dr. Malik, what do you see as some of the biggest barriers?
Well, I think it's trust. Trust is a big issue. When you're dealing with a situation like this, was it just, as you said, it's not about thoughts and feelings, it's not about tears, it's about devastated families, it's about loss that cannot be undone. And I think we have to understand that as a society, that this is something that we're all part of. No matter where you're from, if you're in this country, you are part of this problem. And I think we all have to do our part to try to eradicate that problem.